All right. Good evening, everyone. And thank you for making the time to be here. I'm so excited to really share space and be in community with you. They gave me 15 minutes because they hadn't heard that, I'm Nigerian. I'm a Nigerian Detroiter, baby. So that means I require at least 2 days to make half a point. But we're going to do the best that we can and be in this together. So welcome to today. The topic I have for you and prepared for you is structural racism in Detroit driving health disparities in our great city. My name is Dr. Ijeoma Opara. I'm a physician, scholar, activist, mom, speaker, consultant, coach, and all the good things. Okay, and my pronouns are she, her, and all. And I'm here at Wayne State University School of Medicine and Wayne Health. I'm also director of our Health Equity and Justice in Medicine programs. So Dr. Haley Thompson has already done an amazing indigenous and land acknowledgement, but I do want to acknowledge with gratitude my ancestors who are with us, with me certainly in this moment, and who lived and loved and fought and died for justice and liberation, that I may exist today as a free, proud Black African woman, okay? And I encourage you to do the same. I don't have any disclaimers. My only conflict of interest are these three little queens, Ugo Chinyere, Onwe Bubechi, and Chimamanda, who I take with me everywhere. And my positionality, as I said, I was born and raised in the great country of Nigeria, in the greatest continent of the world, Africa, baby, West Africa, okay? Feeds the entire world, develops the entire world, okay? Okay, ask somebody. And I moved here to Detroit a few years ago, where I trained, and I say, like, I was born in Nigeria, but Detroit raised me, okay? And so I'm a proud Nigerian Detroiter, I like to say. And so I come into this space with humility, acknowledging that there are elders and there are people who have roots here for many, many years that can tell these stories even better than I can. So I want to acknowledge that. So listen, we're going to cover 3 points today. We're going to define and talk about the manifestation of structural racism. We're going to talk about how it shows up in Detroit, just a couple of examples. But honey, you best believe they are plethora of them, meaning many of them. And then we'll talk about how it relates to health and what our role is at all 107 of us right now in this space, what we can do inside of this space. It is very important that we understand that this is not an exhaustive review, baby. They gave me 15 minutes, which is probably now down to 10. And I'm telling you right now, we're going to go a little over. But you didn't hear that from me. But this is not an exhaustive review. This is many people's PhDs. You know, people spend many, many, many years on this topic. In fact, even each subtopic, even just one of those objectives, is many people's lifelong learning experience. So I want that to be very clear. And so what I want to encourage you to do is that, if anything, in the chat, the community can learn, okay? Because as I said, this is to be an interactive community. I'm taking down the Zoom, make me no expert. This is a community, a peace development activity, okay? So I'm learning from you. You hopefully are gonna learn from me. And so to that regard, I do want to start off with sharing some resources, because this work is lifelong. Every day I'm learning something new. Another day I'll tell you what I learned inside of, again, growing in Blackness and in Black liberation and identifying and contending with white supremacy. All the different layers of it, I'm learning every day. And so okay, I apologize. There is a connection thing. So these are just some books that if you don't have them in your library, you want to get a hold of them. So The Origins of the Urban Crisis, Race and Inequality in Post-War Detroit, The Color of Law, A People's History of Detroit, Superior, The Return of Race Science, Medical Appetite, Stamped from the Beginning, How to Be an Anti-Racist, and a whole lot, okay? The 1619 Project also has one for the babies, Born Underwater. I love this book. and I bought this one for the babies and read them for mine. And where can you go to get some of these books? We have Black-owned bookstores in this area. I'm sure a lot of you know about Source Booksellers. We want to support Black business, right? Blackstone Bookstore, Detroit Book City, Hood Book Headquarters, Shrine of the Black Madonna, etc. This is a wonderful podcast. CEnR Radio Season 2 is a good one to start with, that begins to unpack how whiteness was constructed and structural racism, how it resulted from that. And here are some organizations in our area that are doing the work. And again, y'all would know more resources. Go ahead and put that in the chat. What organizations are you part of or you're aware of that does the work of unpacking and dismantling? Because this is not just learning to learn, which is important, right? And awareness building, which is important. It is also building the skill set and the tools to dismantle the system of structural racism and the delusional systems of white supremacism. So DetroitJustice.org, Detroit Will Breathe, BLM Detroit, Detroit Equity Action Lab, and they have a fellowship you can apply for. Michigan United, NewDetroit.org, Race Forward, and Racial Equity Tools.org, and Color of Change. Great groups online, multiple tools. And for those of us in medicine, the Association of American Medical Colleges have collected a bunch of resources, and they are so much more. Again, this is just a brief piece. And so what I was saying is, as we have this conversation, please feel free to populate the chat because again, this is a brief overview. It is not exhaustive. So I am relying on you all for your own collective genius to add to the information and knowledge that we are curating today. So for what has been shared, many of you are going to also know more about it. Put it in the chat, and also during the breakout question discussions, etc. And so I don't know if I started, Carrie, did I start talking about this tweet?
Yeah, yes, you were on your way out when you did.
Oh, okay, good. So again, we have physicians and healthcare professionals who believe that who deny racism. And as I was saying earlier, denial is the heartbeat of racism. And so when we deny and we resist and we push back, what is called the white lash, as you can see, many folks that are banning books and talking about critical race theory, not knowing what it is, but just saying CRT, not knowing what it stands for, what it means, and basically, they're basically just saying don't teach true history, don't tell the truth in schools and in educational spaces. But when we have that's already dangerous, right? Especially these are people who are lawmakers. These are people that are making decisions that impact our lives, our money, our freedom, our education, etc. But when you have folks that have the power of life and death in our hands, right? That is next level when we deny unjust systems and structures and policies and laws and realities and experiences that actually produce the health outcomes that we are supposed to be treating and managing and hopefully eliminating. Denying those realities, there is a next level impact that has, that I'm sure you don't even have to imagine. We see it in the experiences of our patients and communities every day. One very popular one being with maternal health, outcomes and disparities, right? And so this gentleman, this doctor who said no physician is racist, so how can there be structural racism in healthcare, and really spent the rest of the podcast sort of denying and pushing against these realities as a white man, blind to his own positionality and privilege in the world, placed there by a system of white supremacy and anti-Blackness, totally blind to it, and therefore also blind to the harm and injury that he was perpetuating and had been perpetuating in his career, whether unknowingly, but still, regardless, the impact is still true. And he's just an example of many, many others. And what I was saying earlier is that I'm proud to have been part of a group of folks that came together to ensure that he was removed from position, and that there have been fundamental changes that are happening in JAMA, the Journal of American Medical Association, as well as the organization American Medical Association itself. And why is this critical? Again, is because ultimately systemic and structural racism are the root causes and drivers of racial health disparities, which is the area that we are concerned with. And the truth of the matter is that the persistence of these health disparities, in fact, dare I say, the worsening of health disparities, because over time we are seeing a widening gap as opposed to a closure. And so the persistence and the worsening of these disparities and the poor health outcomes in our Black, Indigenous, and Brown communities as a result of our continuing to deny, through the failure and refusal to contend with racism as a historical and ongoing reality sewn into the very fabric of this United States of America. I want to pause here and say, Dr. Leach, can you still hear me? Because now
Yes.
I'm traumatized.
So it's going well. It's going great.
I have to generate, so if you can be texting me from time to time and say, Ijeoma, you're still with us. So let us level set and talk to ourselves around definitions, because we don't want to assume. We have 110 people here. Hey, y'all. And we want to ensure that we are all coming to this conversation from the same place. And so let us define. Racism is a system. It is a system. First and foremost, it is a system. It's not, it's not about hate, although hate can be part of it. It's not about fear, although fear can be part of it. But we need to be clear that it is a system of power. Because I have these conversations everywhere all the time. And, folks break it down and they just talk about, I don't know why people hate and fear. Okay, that can be an outcome. That can be a side effect. That can be a characteristic, but honey, it is fundamentally a system of power that structures opportunity. So those social determinants, education, housing, jobs, justice, and assigns a value of worth based on the so-called race, or the social interpretation of how we look, otherwise known as phenotype. And we get this definition from the amazing Dr. Kamara Jones seen here, all right, who is a godmother in our work, anti-racism work in healthcare, medicine, and academia. And it does 4 things. It unfairly advantages certain individuals and communities. It unfairly disadvantages certain individuals and communities, and it saps the strength of the whole society through the waste of human resources. I just want us to sit with that and let it be clear that the unfair advantage of certain individuals and communities, typically white, right? White, able-bodied, Christian, straight, seemingly, or presenting, okay, property-owning bodies and communities, right? Depends on the unfair disadvantaging of other communities, non-white, non-able-bodied, et cetera, et cetera, et cetera, right? There is a relationship here. The advantaging of one individual, one group of individuals and communities is sitting on the backs of the unfair disadvantaging of these other groups and communities. It needs to be clear that this system of racism occurs and shows up on four levels: a structural level, institutional level, interpersonal or personally mediated level, and internalized. And that is the one level we often don't talk enough about for very obvious reasons. That will be another conversation. But for the purposes of today, we are talking about the structural piece, but be very clear that these levels can happen and do happen simultaneously at the same time. They are mutually reinforcing. They reinforce each other, reproduce each other, and they're intersectional. They relate to each other. They cross-sect and come out and converge inside of each other. So for the purposes of us understanding, we break it down like this, but be very clear that these are all happening at the same time. This is an amazing, powerful scholar of racism and anti-racism, Ibram X. Kendi. Many of you might actually know him and his work, and we've shared some of his resources. And he further adds another layer on to the understanding of racism as a marriage of racist policies and racist ideas that not just produces, but this is key, brethren and sistren. It normalizes these inequities. And that is a very key part of understanding and why folks often struggle with this idea of structural racism, because there is a normalization of the status quo. And what is a racist policy? Really, any measure that produces or sustains racial inequity between groups. Policy written and unwritten laws, rules, norms, procedures, processes, regulations, and guidelines that govern people. So we need to be very clear. Therefore, when we are looking at policies, there is no such thing as a non-racist or race-neutral policy. Every policy in every institution, in every community, and especially this nation, is producing or sustaining either racial inequity or racial equity between racial groups. This needs to be very clear. And it's so key and part, again, of the persistence, in fact, the worsening of health disparities, because people are still engaging in research that they pretend to be race neutral or race or non-racist. No, not in a racist society, it ain't. Every policy, every decision, every process, every practice is either producing and sustaining racial inequity or racial equity. And the question is, where are we on each? How does it show up? It shows up in all sectors of society, in housing, education, policing and criminal justice, the carceral system, healthcare, economics, transportation. It is a system backed by violence. It is historical. It is normalized. It is taken for granted, deeply embedded, and works to the benefits of whites and people in white bodies, to the disadvantage of those in Black, Indigenous, and people of color bodies and communities. I call it that which is hidden in plain sight. There are numerous papers that have, we might need to mute ourselves, family. We might
this
need
is Dr. Opara, this is Haley.
Oh, yes.
You have about like 2 minutes.
Okay.
To wind down? Okay. Thank you.
So we have a number of, I would need 5, sis. And so we have a number of papers that have come out that talk about and have expanded on what structural racism is. I just took one. And we're just gonna, again, because we have just 5 minutes here together, talk about the different ways that it shows up. So economic injustice and social deprivation. So residential, educational, occupational segregation of marginalized and racialized groups to low quality neighborhoods, schools, and jobs, both historical de jure discrimination and contemporary de facto discrimination, reduced salary for the same work, reduced rates of promotion despite similar performance. It shows up in environmental and occupational health inequities, so strategic placement of bus garages and toxic waste sites in or close to neighborhoods where Black and brown communities predominantly reside. Also, government failure to prevent all kinds of toxicity in our air, water, and soil. Cue Flint, cue Detroit, right? And a disproportionate exposure of workers of color to occupational hazards. It shows up in trauma, okay? It shows up in targeted marketing of health-harming substances, a big one being tobacco and beverages and certain unhealthy foods, which we know, litter our city, all right? It shows up in also in inadequate healthcare. There's a reason why there's only so many numbers of healthcare settings, hospitals, clinics, healthcare centers here in the city versus not. It shows up in state-sanctioned violence and alienation from property and traditional lands, political exclusion, maladaptive coping, and stereotype threats. And so I'm going to very quickly just name a few ways that it shows up here in the city of Detroit. Redlining, all right? I know y'all know what it is. Go ahead and put in the chat what it is. Essentially, it's a discriminatory practice that mortgage lenders use to deny loans, and insurance providers restrict services to certain areas of a community because of the racial characteristics of those communities. So they were unfair and abusive loan terms. It was sponsored by the federal government, and there's a decades system started in the 30s, was supposed to to end in the 60s, but continues sort of de facto today. System of racist housing policies that result in persistent segregation of American metropolitan areas today, leading to absent economic opportunity and stagnant inequality. Okay, this is the city of Detroit. You can see these red areas. These were the areas that they said, well, there are a lot of Negroes and Jewish people there, so no loans given. This is the 8 Mile Wall, which was one of the structural ways that was put in place to create that segregation division. There were also non-structural ways. It wasn't necessarily a wall, but you couldn't really, go from one community to another. And Alter Road and Kercheval Avenue that separated the city of Detroit from Grosse Pointe was one example. Since then, I want to say 2 or 3 years ago, they did demolish the roundabout that was put in place to emphasize that division. And this has shown up in very many ways. Racial covenants, persistent. To today, loans are written majority to white applicants, and the most segregated areas in the country are in our Detroit, Dearborn, and Livonia areas. It shows up and has consequences in terms of lower socioeconomic status, home ownership, wealth, nutritional status. It's affected our health and our lifespan that has been shorted. We know from studies that in historical redline areas, people are living at least an average of 5 years less than places that were historically green lined. We see it in our preventive care, diabetes, cancer, hypertension, and there's a whole list of disparities as a result of redlining. And here you see in our area here in Wayne State, 69 years of age and average life expectancy, but 2 miles up, Grosse Pointe areas, people are living up to 82 years of age. And that's because of the impact of structural racism, one manifestation being redlining. I'm going to close up my comments. There's so much more to share, to be honest with you, but by simply saying this, there's also this piece I will be remiss if I don't mention, that climate issues and environmental issues are also tied to this. So the issues around lead, the issues around heat that then shows up in worsening of chronic illnesses. So there is a study that 2 years ago that linked the heat that we are disproportionately exposed to redlining and other racial covenants and other policies that instituted segregation. Another example that I was going to talk about, because I'm wrapping up because of the time, was the ways in which our highways, right, how structural racism was baked into the highways, and how I-375 North divided what was Black Bottom and Paradise Valley, which were Black communities back in the days in the 40s, 20s, 30s, 40s, and was one of the most prosperous in the 20th century African-American communities. But then I-375 North was built to demolish and decimate that community, that we never recovered from that action. And we saw a loss up to 3 generations of Black wealth as a result of just that one action. And just to point out that, that is one of many examples. We can trace a through line into the way our educational system is structured and shows up here in the city of Detroit, how it shows up in, again, healthcare, in the transportation issues that we have as well. All can be linked to structural racism. And these pieces then show up in the healthcare challenges we have with hypertension, diabetes, cancers, autoimmune illness, and the list goes on. So what can we do? 3 important things, and I'll end. One is that we can choose to be anti-racist. We can choose today to say, listen, in a racist society, there's no such a thing as not be racist, not racist. There's no such thing. Neutrality supports the status quo, and the status quo is racism. So the choice to be anti-racist, to ensure that we, through our languaging, through the choices and decisions we make, through our voting, through the ways we show up in healthcare, in research, in policy work, in decision making, is intentionally anti-racist, that we are using the language that calls out and identifies and calls a spade, calls a thing, and calls it for what it is, and connects the dots to the outcomes that we struggle with in terms of wealth and health disparities here in the city of Detroit, here in the metro Detroit area, here in Michigan, here in the United States, is at the very least that each and every single one of us can do. And then we can too translate that to civic action, translate that, rather, I would say, to our families and our spheres of influence. Who do we teach? Our children, our classmates, our colleagues, our workers, the people in the church, in mosque, in temple, in our various spheres of influence. We can teach and educate each other. And then we can translate that thirdly to civic action. How do we vote? How do we hold those elected officials accountable to ensure that the policies that they are promoting and putting in place are anti-racist, that they have the effect and impact of promoting racial equity and justice and not inequity and injustice. And so with that, I rest my mic. I thank you for the generosity of time and attention. I apologize sincerely for the technological issues that occurred, and I hope that we can continue the conversation at another time when I'll have a whole hour. How about that? Thank you so much. Have a great evening.